there's some people in here who are thinking to themselves probably like, I never go see my doctor. Or they might say, I don't even got a doctor. Or I don't have a plan. And maybe the plan is just to first, find insurance or see a physician, right? Or see a provider.
Yeah.
And so I guess the question I have to try to give like a next step, because with this podcast, I really had two visions, is to educate and to inspire. And I believe that all underlying that will be some faith component, right? Because that's who we are here.
Yeah.
So lastly, I just wanted to ask you, like, if you're looking for a physician or a provider, like what kind of characteristics and skills would you give advice to? When they're thinking about doing that, like what would you be looking at, or what would you give advice for our listeners or viewers to say, yeah, you know what, I'm going to get a provider and these are some things that I should probably look for.
Yeah, and I think this is really probably the most important thing when you find a provider, is that you find the right provider for you.
Yeah.
I mean, obviously, I think having somebody who's board certified, which is kind of standard for today's medical communities. Like, you can't work at Providence, you can't work at most institutions if you're not board certified.
Okay.
It just says there's a level of competency that has been demonstrated within your specialty. But I think the most important thing is that you feel a connection, right? The most important thing when I see a patient. Mm-hmm. I would say 85% of any decision I make regarding the healthcare is strictly based on the conversation that I have with them.
Wow.
So if you give people enough time,
Yep.
which is a challenge in today's medical economics, give them enough time to have the conversation, let them speak with you, and the right questions to ask. Then when you go do an exam or you do laboratory test or some type of investigations, those things really should be more confirming what you suspect based on your conversation. Mm-hmm. And I was trained in medical school that if you have spoken with the patient and you don't have an idea of what the problem is by the time you're done talking, you haven't spoke to them long enough, right? So I don't expect my patients to ever know medicine better than I know medicine.
Yeah.
But I can't be so arrogant to think that I'll ever know their body better than they know their body. Right?
Yep.
It's a partnership. It has to be something that is a back and forth. So the most important aspect for me to provide good care is the patient's willingness and comfort level in providing me information. Mm. And so when a person doesn't feel that comfort, they will hold back, right? That's just the way we are in any relationship. If we don't feel comfortable, we won't open up. And if you can't open up to your physician, they may be the smartest doctor in the world. They will not provide you good care. Mm. So I always tell people, whether it's me or somebody else, you need to feel comfortable. So I let my patients, I tell them at the end, I say, if you got questions about me as your provider, that's fair game, right? You're coming in, it's like an arranged marriage, right? We have a relationship. I'm their doctor, they're my patient, and we don't know each other, right? That the relationship is developed in time.
Yeah.
And so it's important they feel comfortable. If they don't feel comfortable, then they need to find a different doctor, because I know I won't provide them good care if they come in and they hold back information. So finding somebody that you feel comfortable enough to be able to tell them anything you need to tell them, right? Mm. I mean, and there are things that people tell me they would never tell their spouse or anyone else, right? It's a very intimate relationship. So you have to be comfortable. So find the person that you feel like, I'm not going to hold back information. That is the most important advice I can give anybody finding a doctor. And the reality is, it's not, it would be unrealistic to think that every doctor is going to fit with every patient.
Right.
I mean, it's just not the way life is, right? So if you're not comfortable with your provider, find a new doctor.